Which was the innovation and evolution in inhaler device?
So the evolution of the inhaler devices over the last 60 years have really involved a lot of innovation from formulation scientists and also from engineers. But the problem that we found is that over the same period of time, inhaler technique has not improved with patients. And one of the biggest problems here is not the fault of the patient, it's the fault of the healthcare professional. They don't know how to teach their patients to use the inhaler properly.
You said patient technique has not improved over time. Which are the most common mistakes?
Simply, we have two main classes of devices, metered-dose inhaler and dry powder inhaler. And the key point with the metered-dose inhaler is our patients inhale too fast. So they shake the inhaler and they go too fast. And what we need them to do is just to inhale slowly and deeply. Slowly and deeply meaning they inhale over 3 to 4 seconds, gently and deeply and comfortably. In contrast with dry powder inhaler devices, our patients do need to have the lung power in their lung muscles to generate pressure and force and flow to be able to break the powder from the dry powder inhaler device. And therefore many guidelines say you need to inhale quick, deep, hard and fast.
Which is the contribution of poor inhalation technique to the burden of illness in asthma and COPD?
There's a huge health economic burden that is unrecognized when patients are not taught how to use their inhalers properly. A study by Lewis and colleagues showed that the use of 2 devices in 1 year in 3 countries, the indirect and direct costs on the health system was nearly €750 million. That's really significant, and governments really need to wake up to this burden and try and support proper training of healthcare professionals with respect to inhaler technique.
Which is the role of digital health in monitoring the medication use remotely?
Global data shows that currently there are 300 million people with asthma, and this is projected to rise to 400 to 450 million by 2025. And staggeringly, a recent report in the UK showed that up to 50% of these patients don't actually take their medication as prescribed. So there is a real problem with adherence. Digital innovation, digital health may help in terms of assessing adherence in our patients. Rather than just asking our patients when they come to clinic or self-reported questionnaires, the future may see digital innovation with inhalers that can track when a patient uses the inhaled medication and how often they are using it.